Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your health. Tonight, do not think of sleep as a switch. Think of it as an orchestra. The brain must dim its alerting systems, body temperature must fall, inflammation must quiet down, muscles must stop sending distress signals, and the circadian clock must agree that night has truly arrived. Now ask yourself, why does one person go to bed exhausted and still remain awake? How can the body be tired, yet the brain refuse to sleep? Look beyond the pillow. Look beyond the mattress. Look beyond willpower. Insomnia is often treated as if it lives only in the mind, but the biology of sleep is distributed through the whole body. Hormones, immune signals, neurotransmitters, pain pathways, light exposure, metabolism, and even nutrient status. Vitamin D enters this picture not as a sedative, not as a knockout pill, but as a regulatory hormone-like nutrient that may help restore conditions in which sleep becomes easier to initiate, deeper to maintain, and more refreshing to complete. So listen carefully. Do not use vitamin D as a quick sleeping tablet. Use it as a biological correction when the body is missing something it needs. Why? Because the evidence suggests that low vitamin D status is associated with poorer sleep quality, shorter sleep duration, and more sleepiness, while supplementation may improve sleep quality in some people, especially when deficiency or insufficiency is part of the story. A 2018 meta-analysis in Nutrients found that people with vitamin D deficiency had a higher risk of sleep disorders, poor sleep quality, short sleep duration, and sleepiness. It also noted that serum 25-hydroxyvitamin D below 20 nanograms/ml was linked with unhealthy sleep patterns. Start with the first, why? Why would vitamin D have anything to do with sleep at all? Because vitamin D is not merely a bone vitamin, it behaves more like a neuroimmune signal. Vitamin D receptors have been described in brain regions involved in sleep regulation, including hypothalamic areas connected to circadian timing. Reviews of the sleep literature describe possible roles for vitamin D in neurotransmitter metabolism, inflammatory cytokine regulation, oxidative stress control, neural plasticity, and interactions with melatonin-related pathways. Now ask the next question. How does that become insomnia? Imagine the night brain as a locked door. Melatonin is one key. Darkness is another. Calm breathing is another. Stable blood sugar is another. Reduced pain is another. Vitamin D may not be the master key, but it may help cut several smaller keys more accurately. First, consider the circadian clock, the suprachiasmatic nucleus. The brain's central timekeeper responds to light, but the larger circadian system also interacts with hormones, immune signals, and gene expression. Vitamin D signaling has been discussed in relation to clock genes and sleep-wake regulation. So do this. Stop thinking only about bedtime. Think about morning. Get outdoor light early when possible. Take vitamin D earlier in the day if supplementation is appropriate. Why earlier? Because many people tolerate it better when it is aligned with daytime biology rather than taken close to bedtime. Second, consider melatonin. Do not reduce melatonin to a supplement bottle. Melatonin is a darkness signal produced by the body. Vitamin D has been discussed in relation to enzymes and pathways involved in melatonin synthesis. The point is not that vitamin D makes you sleep in a direct, drug-like way. The point is subtler. If vitamin D status is poor, some of the background chemistry that supports normal night signaling may be less stable. Ask yourself, how can the brain create a clean night signal if daytime biology is disorganized? Third, consider inflammation. Insomnia often feels psychological, but the immune system can whisper into the brain all night. Inflammatory signals such as cytokines can influence fatigue, sleep pressure, pain sensitivity, and nighttime awakenings. Vitamin D is known to participate in immune modulation, and sleep-focused reviews have proposed that downregulation of inflammatory markers may be one pathway by which vitamin D status relates to sleep quality. Fourth, consider pain and muscle function. Tell the audience this plainly. If the body aches, the brain keeps checking the body. Vitamin D deficiency can contribute to bone pain and muscle weakness, and the NIH Office of Dietary Supplements notes that long-term deficiency may cause osteomalacia in adults with bone pain and muscle weakness. If nighttime discomfort is one hidden driver of waking, correcting deficiency may reduce one layer of physiological alarm. Now, move from mechanism to evidence. What do studies actually show? In a double-blind clinical trial published in Nutritional Neuroscience, adults aged 20 to 50 with sleep disorders were randomized to vitamin D or placebo. The intervention group received 50,000 IU every 2 weeks for 8 weeks. At the end, the vitamin D group showed improvement in Pittsburgh Sleep Quality Index score, sleep latency, sleep duration, and subjective sleep quality compared with placebo. Their average sleep duration increased from about 5.83 hours to 6.50 hours, while sleep latency fell from about 50 minutes to about 33 minutes. Pause there. Do not exaggerate it. Do not say vitamin D cures insomnia. Say this instead. In selected people, especially those with poor sleep and low or suboptimal vitamin D status, supplementation may shift sleep in the right direction. That is the medically responsible message. A 2022 systematic review and meta-analysis of intervention studies looked at vitamin D supplementation and sleep outcomes across 19 studies, including randomized controlled trials. The reviewers concluded that vitamin D may improve sleep quality, while the effects on sleep duration and sleep disorders were less clear. The National Center for Complementary and Integrative Health summarizes the same general point. Vitamin D may help sleep quality, but evidence is not firm enough to treat it as a universal insomnia therapy. So ask, who should pay special attention? Consider people who get little sun exposure, wear full coverage clothing, have darker skin, live far from the equator, work night shifts, have obesity, malabsorption conditions, older age, or diets low in vitamin D sources. Consider people with bone pain, muscle weakness, fatigue, low mood, or recurring poor sleep despite good sleep hygiene. Do not guess forever. If there is a medical reason, ask a clinician whether a 25-hydroxyvitamin D test is appropriate. But also be precise. The 2024 Endocrine Society guideline became more cautious about routine testing and high-dose supplementation in generally healthy adults. It advises that healthy adults under 75 generally follow recommended daily intake rather than automatically taking higher doses, and it suggests against routine screening in healthy adults without a clear indication. That means we must be disciplined, correct deficiency, support adequacy, and avoid turning a useful nutrient into an uncontrolled experiment. Now give the audience a clear plan. First, measure the pattern. For 2 weeks, track bedtime, wake time, sleep latency, night awakenings, morning light exposure, caffeine timing, alcohol intake, pain, mood, and supplement use. Why track? Because insomnia lies. At 3 a.m., every night feels the same. On paper, patterns appear. Second, check the basics before blaming the brain. Are you getting morning light? Are you taking caffeine after lunch? Are you exercising too late? Are you eating heavy meals close to bed? Are you scrolling under bright light at midnight? Fix these first. Vitamin D works best inside a coherent sleep strategy, not as an excuse to ignore circadian hygiene. Third, build vitamin D through food and light when possible. Use fatty fish, fortified milk or plant milks, fortified cereals, egg yolks, and sensible sun exposure when appropriate for your skin type, season, and medical risk. Do not burn your skin. Do not chase sunlight recklessly. Use judgment. Fourth, supplement intelligently if needed. Many adults use daily doses around the recommended intake range, while clinicians may prescribe higher short-term doses for documented deficiency. The NIH lists the adult upper limit as 4,000 IU per day from all sources unless a healthcare professional recommends otherwise for a specific reason. Too much vitamin D can raise calcium excessively and cause nausea, weakness, confusion, dehydration, excessive urination, kidney stones, kidney failure, irregular heartbeat, and in extreme cases, death. Fifth, take it with fat-containing food, preferably earlier in the day. Vitamin D is fat-soluble, so absorption is generally better with a meal that contains some fat. If someone says, "Vitamin D keeps me awake," do not dismiss them. Move it to breakfast or lunch. Reduce the dose if needed. Reassess. How do you know whether it helps? Track sleep latency, awakenings, total sleep time, and next day function for several weeks. Sixth, watch medication interactions. The NIH notes that orlistat can reduce vitamin D absorption, steroids can lower vitamin D levels, and thiazide diuretics can raise the risk of high calcium when combined with vitamin D. Tell your clinician and pharmacist what you take. Do not hide supplements as if they are not biologically active. Seventh, do not miss dangerous sleep disorders. If insomnia comes with loud snoring, witnessed pauses in breathing, gasping, morning headaches, severe daytime sleepiness, restless legs, depression, mania, panic, chronic pain, thyroid symptoms, or medication changes, investigate. Vitamin D may support the terrain, but it does not replace diagnosis. Now return to the central idea. Why can vitamin D be beneficial? Because sleep depends on biological readiness. Vitamin D may help the brain regulate sleep-related pathways, may support immune balance, may reduce deficiency-related pain and muscle dysfunction, and may improve sleep quality in some intervention studies. How can it be effective? By correcting a deficiency that quietly strains the sleep system, by supporting day-night signaling, and by fitting into a broader plan. Morning light, consistent wake time, reduced evening stimulation, appropriate nutrition, and medical evaluation when needed. So tonight, do not ask only, "What can knock me out?" Ask a better question. What is keeping my body from feeling safe enough to sleep? Is it light at the wrong time? Stress, chemistry, pain, inflammation, a breathing disorder, a missing nutrient signal? Use vitamin D with respect. Test when medically appropriate. Supplement when indicated. Take it earlier in the day. Pair it with real sleep hygiene. Avoid excessive dosing. Track the response. And remember, the goal is not artificial sedation. The goal is restored rhythm. When the body receives the right signals in the right order, sleep becomes less like a battle and more like a return home. Take care of yourself, take care of each other, and I'll see you with our next health topic, like family, learning one step at a time.